name is Lauren Crabtree, and I'm here to do my video assessment. Here's my patient, Janet. Hi, Janet. How are you doing today?
Doing all right.
Doing all right. I'm going to hygiene real quick. So first, I'm just going to assess her skin just from looking at her. It looks like she has pretty clean, dry skin. I see a couple freckles. Capillary refill's good. Dry. No noticeable odors or hygiene issues. There's one tattoo on her forearm. Warm and dry on this side. Capillary refill's good also. Looking at her face, there's no open wounds or lesions or sores that are noted. Have you had any problems with rashes that you've noticed in the last few days?
No.
Okay, I'm going to just look at your legs real quick. No, those are clean, dry down there, so that looks good. There's also another tattoo down here. Okay, just going to take a closer look at her head. Looking at it, looks symmetrical. Looks good. Skin also still looks really good on the face, and palpate her head for any noticeable malformations, that tender anywhere. Okay.
Nope.
And I'm also going to check her sinuses. Any pressure, anything, tenderness.
Nope.
Any tenderness with that.
Nope.
I'm also going to check her TMJ and just, does that hurt at all? Okay.
No.
Smooth. I'm also going to check for her temporal arteries. And those are good also. Alright, so for this portion, I'm going to assess her eyes. I'm just going to have you take your glasses off for me real quick. I'm going to shine a bright light in your eyes. Just look straight at me. I'm going to check for perla. Again. This eye. That's good. Perla's good, equal and reactive in both eyes. Now I'm just going to have you stare at my pen light and then follow my pen light with your eyes, checking her cranial nerves. And those are all intact. And then now I'm just going to pull down on her eyelid, check the conjunctiva, and it looks good. And then her sclera is also white. Any problems with drainage or runniness or anything? Alright. And then now I'm going to check your peripheral vision, so I'm going to get real close to you, and then you just tell me when you can see my fingers move.
No.
Okay. I'm going to do it again.
No.
Alright. So that's good. And then now I would also assess her vision, so I would use the Snellen chart. I would have her stand 20 feet away from the Snellen chart, have her read the lowest line that she could read, and then that number would be what her vision would be. Alright, so for this portion I'm going to take a closer look at her nose, her mouth, and her ears. So first I'm just going to inspect her ears. I notice they're symmetrical on both sides, about the same length. They look clean and dry. Any problems with drainage or anything. So first I'm just going to inspect them. So I'm going to pull back and up on her ear. I'm looking through it now. Those look good. And then we'll do that same thing on this side. That's good also. And then now I'm going to perform the whisper test. So I'm going to cover one ear and then whisper.
Apple.
And the same thing on this side.
Apple.
Good job. Next, I'm going to inspect her nose. And then just pull up on the top of your nose and look into her nose. No drainage or anything wrong with the nose. Nose looks good. There's no drainage or dry boogers, nothing there. Alright, so next I'm going to have you open your mouth. I'm going to inspect your mouth. Can you say ah for me? Stick out your tongue. Alright. There's no open wounds, sores, or lesions. Mouth looks pink, moist. It looks good. Alright, for this portion, I'm going to take a closer look at her neck, and I'm going to notice that it's symmetrical. Take a look at her trachea, it's midline. I'm going to check her thyroid. Don't notice any nodules or anything, so then I'm going to check for her lymph nodes. Any tenderness, soreness with that?
Nope.
Any soreness, tenderness, and these?
Nope.
I'm going to also check her carotid pulse. And it's good on that side. Check one more time. Okay. And it's good on that side. Alright, so for this section I'm going to take a closer look at her chest cavity and her lungs and her heart. So just looking at it, the chest wall looks symmetrical. I'm just going to palpate for any nodules or lesions. Is that tender anywhere that you're noticing? I'm also going to assess the back at the same time.
No.
No noticeable palpations. From looking, I don't see any open wounds or lesions. Then I'm going to also take a listen with my stethoscope. And each time that I move my stethoscope, just take a deep breath for me, okay? Deep breath in and out. Anteriorly, the breath sounds are clear bilaterally. Don't hear any wheezes or any crackles noted. I'm also going to do the same thing to her back lungs here. Take deep breath for me. Okay, and then for the next part, I'm going to have her whisper for me. I'm just going to have you whisper the number 99, okay?
Okay.
And I did not hear anything. So lung sounds on posteriorly are clear bilaterally, no wheezes or crackles noted. And now, next I'm going to take a listen to her heart sounds. First I'm going to listen for the aortic valve. And next I'm going to listen for the pulmonic valve. And then the tricuspid valve. And then the mitral valve. Heart tones are normal, regular rhythm, no murmur noted. Okay, so now for this section, I'm going to assess her abdomen. Janet, if you could just pull up your shirt for me real quick and take a look. Looking at the symmetrical of it, it's very symmetrical. There's no open wounds or lesions, no rashes noted. Skin is intact. Now I'm going to take a quick listen to your belly real quick, okay?
Okay.
All right, bowel sounds are normal, active in all 4 quadrants. So now I'm going to lightly palpate on your belly and you tell me if you feel any tenderness, okay? Okay. Any tenderness there? Okay, next I'm going to percuss for her liver borders. Then I'm going to try and palpate for the spleen and see if I can feel it. Take a big deep breath for me. Okay, and then I'll try and palpate for the spleen. Take another big deep breath for me. Alright, and then I don't feel the spleen at all. I'm just going to do some deep palpation here. Any tenderness? Alright, you can pull your shirt down. That part's done. Thank you. Alright, for this section we're going to test her upper extremity strength and her lower extremity strength. So I'm going to first palpate her fingers and her hands, for noticing for any nodules or lumps that might be for rheumatoid arthritis or anything. Right, and then next I'm going to test the range of motion in her hands. So I'm going to have you, with one of them is fine, I'm going to have you abduct your hand and then adduct your hand, and then extend and flex your hand. Alright, and then we're going to do for the arm, we're going to pronate, supinate. Okay, and then we're going to test the range of motion in your shoulders.
Okay.
So I'm going to have you bend up and then try to scratch your back. Alright, and then reach backwards and try to reach your scapula. There you go. And have you lift your arm out. Alright, and then across. Alright, good job. Alright, and then next I'm going to test the same thing in her feet. I'm not going to have you take your socks off, but I will just assess her feet and then I'll have you do the same thing with your ankles. I'm going to have you extend your ankle and then flex your ankle. There you go. Alright, and that looks all good and intact. So next I'm going to assess your gait and your mobility. So I'm just going to have you stand real quick. Then I'm just going to have you take a couple steps forward for me. Noticing her gait and her balance are all intact. Okay, And then next, I'm gonna test her Romberg, and I'm gonna have you stand, place your arms out straight forward, and then close your eyes. She sways a little, but there's not a positive Romberg. Okay, you can open your eyes. Next, I'm gonna have you kind of squat down, see how your knees do. There you go, and come back up. All right, and that's it. Okay, next I'm gonna test her range of motion of her spine. I'm gonna have you extend, and then flex down as far as you can. All right, and then now while she's down, I'm going to palpate her spine. Notice for any nodules next to her spine. While I'm doing this, I can test for any scoliosis. Her spine does make a nice S-curve, so there's no scoliosis noted. Okay, you can bend up. Okay. For this section, I'm going to test her coordination. First, I'm going to start with the rapid alternating movements. I'm going to have you hit your knees, palms up, down, and then up, and then there we go. And then do that as fast as you can. All right, good job. So for next, I'm going to have you touch my finger with your finger and then touch your nose as fast as you can, okay? Nose, finger, nose, finger, nose. Okay, one more time. There you go. All right. Okay, now for this section, I'm going to check her reflexes and then check her patella reflex real quick. Okay, check the other one. All right, good job. Now the next one, I'm going to check her brachioradialis. I'm going to roll your sleeve up just a little bit here. Okay, I'm going to hold here and then I'm going to tap right here. And then feel for the slight jerking movement. Okay. And then I would test on the next side also. And then for the next part, I'm going to test the sensation on the side of her face. I'm going to have you just close your eyes for me, okay? And then you tell me which side you feel this on.
Left.
Okay.
Right.
Alright, so next I'm still going to assess for sensation. I'm still going to have you close your eyes for me.
Okay.
Tell me which arm that I'm touching this here.
Right.
Right.
Left.
Okay. And then I'm going to pull up your pant legs real quick on both sides. Okay. And you tell me which side that I'm touching here.
Left. Right.
Alright. Okay. And then next I'm going to have you take your right heel, move it up your left shin to your knee, and then back down for me. Okay, I'm going to have you do the same thing with your left leg. Down. All right, and then I'm going to take this sock off and check the Binsky real quick. Alrighty. That was a negative Babinski. And at this point, I am finished with my assessment. Do you have any extra questions for me, Janet?
No.
Anything that I can help you with today?
Nothing is okay.
All right, and that ends my assessment.